Welcome back everyone, this is Dr. J from LifeSpine Health Enhancement Center. Today's video talks about an important topic that I get questions about all the time, and that's about degenerative disc disease. It can also be called degenerative joint disease, and the common term for it is skeletal arthritis. Now, many of my patients and many of you may have been told that arthritis is a normal condition that happens simply because we get older, and that could not be further from the truth. Arthritis is a simple effect that certainly has a cause, and yes, time does play a part, but it more has to do with how you take care of your spine to prevent degeneration from happening. It can be paralleled to dental hygiene. If you take good care of your teeth, you brush them, floss them on a daily basis, and get checkups by a qualified professional, i.e. your dentist, then you can ensure that you're doing the best for your teeth to keep them healthy, to prevent decay or degeneration of those teeth, so you can keep them for as long as you so choose to. But people neglect their spine because it's out of sight, out of mind, and they feel that they do not have any power to control how healthy it is because they've been told their entire lives that arthritis is normal and there's nothing you can do to prevent it. But this video is going to tell you exactly how arthritis develops in the spine so that you can know that there's something that you can do to prevent it. And simply because your dad or mom or grandma had arthritis, that doesn't mean that you have to have it either. So let me first show you what a normal healthy joint looks like in the spine. These are two low back bones or lumbar vertebra. Now in between the two smooth block-shaped bones, there's a nice tall cartilage disc, and I have other videos that talk about this as well. But that disc provides three things. One, it provides a soft cushion or shock absorption for the bones to sit upon, and they allow for a free range of motion as we bend, extend, and rotate and do the things that we need to do on a daily basis. The last thing it does, which I've mentioned before, is it creates a space in between the bones that forms a hole, and a nice tall healthy disc will create a nice large opening that allows for free uninterrupted communication of the spinal nerves as it exits and performs all the necessary jobs it needs to do. Not just muscular motion, but also controlling our intestines and our liver and our kidneys and our heart and our blood pressure, etc. So it's imperative that you take good care of your spine to ensure that you have the healthiest nervous system, not just today, but this goes well decades down the road, so that when you're 80 and 90 and 100 years old, you know that you've done what's needed to do throughout your entire life to ensure that you can remain independent and as healthy as possible. The last thing I want to share for you is the structure of the disc. I like to think of it as like a water balloon or a jelly donut. And in a jelly donut, you've got the outside and then you've got the inside filling. And that's exactly what the disc has. It has what's called the nucleus, which is creates a pivot point and a fulcrum for movement, but also that nucleus is surrounded by concentric rings, and those rings form the walls of the disc that hold that nucleus in place and keep the disc fully intact and healthy. Now, the other important component that keeps the disc healthy and keeps your spine healthy is how the blood flow is supplied to the disc. Only the outer 1/3 to 2/3 of the disc have direct blood supply by blood vessels. The only way that blood supply and fresh oxygen and nutrients get to the inner portion of the disc to keep it healthy is from a process called imbibition. And if you look it up on Webster's dictionary, it'll say it's a chemical process that causes absorption of a liquid into a solid or a gel. And that's what that disc is. It's like a gel substance that has to absorb liquid from the areas around from it. The liquid is the blood. And it gets the blood flow from the bones above and below that particular disc. Now, how does the blood get drawn in? That's the most important part. The process of imbibition requires pressure changes, and the only way that you can change the pressure of the disc is by moving the disc, kind of creating an accordion or a pump that's going to allow the blood from the bone to be drawn into the inner third of that disc to give it the oxygen and nutrients that it needs to stay healthy and not degenerate over time. to describe what this looks like, I've got a very high-tech tool that I'm going to use, all right? So imagine that this balloon, let's see if I can get it right here. Imagine that this balloon is a disc in your spine and that my fists represent the bones. Now, when your bones are in proper alignment, like if you're looking at me from the front here, if they're in proper alignment, that disc is going to have equal pressures on the right side and the left side of the disc. It will bulge equally and distribute the forces the way it should. Now, if you have a subluxation or a misalignment in your spine and those bones become tilted, well, then what happens is that that disc bulges unequally to one side, and that causes a disc bulge. Now, if that disc bulge is not removed, the only way it can be removed is to realign the bones. But if those bones are not realigned and they stay there for years and years and years, it's very likely that that bulge will eventually rupture and that disc will burst, leaking out some of that inner nucleus of the disc. And a little of that material will make the disc smaller. Now, on X-ray, you cannot see the disc itself, but you can see the space that it creates. And the closer the bones are together, tells us that that disc has been damaged over time. And if that alignment issue is not addressed, over time, that disc will repeatedly leak, and those bones will get closer and closer and closer together until now they're sitting right on top of one another, preventing your free range of motion, producing a lot of pain, and eventually degeneration, complete degeneration of that disc, and severe arthritis of the spine that possibly needs to be corrected by surgery. And trust me, you do not want to allow it to get to that point. The trick is identifying it early enough so that you can prevent further degeneration. How do you prevent that degeneration? Remember what I said, you need proper alignment to take pressure off that disc. The other key component of healthy discs is that imbibition. And when your bones are stuck and they're not moving, that means that disc isn't moving as well. And that disc isn't having that pumping motion to keep the inner portions of that disc healthy and hydrated. So that's what causes the inner part of the rings to crack and leak from the inside out, and I'll show you that in a minute. But when you get adjusted by a chiropractor and they restore full motion to the bones, that disc is getting exercised and that disc is imbibing blood flow deep into that disc to keep it hydrated and healthy. The chiropractic adjustment is the only thing that can keep that disc healthy to prevent degeneration down the road. Now, once again, here's what a healthy disc looks like. It's fully intact and that nucleus is held within the disc. When you have a subluxation or a fixation in the spine that's preventing free motion to the disc, it prevents the blood flow from getting to the inner portion of the disc. And what's going to happen is those inner rings are going to start to crack. They're going to dry out, they're going to crack, and they're going to break. And that inner nucleus, or that inside of that jelly donut, is going to start to slowly leak out towards the outside. So now instead of having 13 or 14 rings holding that nucleus in place, now you only have 7 or 8. And so that pressure is going to bulge the disc outwards towards the spine. And that can put pressure on a spinal nerve. That's called a bulging disc. Now, if that misalignment and if that motion is not restored to the disc, this process will continue, and that bulge will eventually cause a full herniation of that nucleus material as it breaks through every single ring of the disc and chemically irritates those nerve roots, causing pain, sharp shooting discomfort, or that sciatica when it happens down into the lower back. But this can happen anywhere in the neck. Anywhere where there's a motion restriction or a misalignment in the spine, it's going to prevent the proper blood flow, the proper hydration. That disc is going to deteriorate over time. It's going to get thinner and thinner and thinner, as this one sees. Notice how closer and closer the bones are becoming. And then, well, it's upside down here. And then notice how the hole in the back of the spine becomes smaller. And so you're much more likely to pinch and irritate that nerve. If that process is not stopped, then over years and years and years, it takes about 30 years to get this bad. But notice the difference between a healthy joint and a severely degenerative joint. And if you wait to go to the chiropractor until it's this bad, then there might be very little for what we can do for you at that point in time, and surgery may be the only option left, not just to find you relief, but to keep you independent and healthy into your older age. So it's imperative that if you've ever been in an accident, if you've never had your spine checked, period, get it checked by a chiropractor to see if you have any asymmetries or imbalances or misalignments in your spine that have probably already started that degenerative process. And make sure that your chiropractor is taking x-rays to evaluate the health of your spine and the health of your discs. And here at our office at LifeSpine, we offer rehabilitative care to the spine, where we can identify where you are now and where you need to be in the future, and we can have a well thought out plan of events to get you from point A to point B. And that's going to start to teach you how to properly take care of your spine and introduce those proper spinal hygiene habits that have been missing probably, throughout your entire life. It's something that is gaining a lot of momentum now. People are learning more about chiropractic, and I hope this video did help shine some light on why you might be having low back pain and how you can prevent degeneration from ever happening. You need to have faith in your body's ability to heal itself. And you need to understand that arthritis just doesn't happen because it's the luck of the draw. There is no genetic code for arthritis, and you can work to prevent it. So please, I hope this video helped once again. If you'd like to learn more information about spinal health, please visit our website. It's at www.lifespinecenter.com. We have a lot of helpful information there that you can subscribe to and get weekly updated information. Also, we have more videos found on YouTube. You can find us at LifeSpine at YouTube, and you can subscribe to our channel as well. I hope this helps. Once again, my name is Dr. J from LifeSpine Health Enhancement Center.